Hello, I'm Dr. Nighat, a GP with a specialist interest in women's health, and I work here at Welbeck. I'll be talking about some of the common questions that I get asked about endometriosis. What is endometriosis? Endometriosis is a lifelong inflammatory condition which causes cells which are similar to the lining of the womb. So in my model, let me just quickly show you. So the endometrium is the cells that are growing inside the uterus, which is the womb. Now we think it's cells similar to the lining of this that get deposited outside into the pelvis and in and around the womb. And when it does that, it's ever so sneaky. What it does is it finds other endometriotic cells around it, and then it causes scar tissue or adhesional tissue, so similar to what you can see on here. What that does is it mats down the organs. In the process of doing that, it causes inflammation. We've now understood that that inflammation causes effect in the whole body. We've also understood that endometriosis is not a condition that just is limited to the womb. It's actually a whole body condition. It impacts our immune system as well as causing symptoms irrespective of whether you're having a period or not. And because it mats down the organs by adhesional and scar tissues, these organs can't be mobile, and therefore it causes impact to our rectal tissue, so our bowels in the back, as well as our gut. And we've now even found endometriosis in lung, in brain, and in skin tissue. So it's a lifelong, whole body condition which causes multi-systemic effect in the body. The symptoms of endometriosis are vast. So we can get psychological symptoms. In fact, we know 40% of women and girls feel that they're getting symptoms which affect them before even their bleed happens. So for example, you can get brain fog, irritability, low mood, you can get anxiety as well. We also know that you can get rectal pain, so pain that is going to be affecting you even before the bleed happens. We know the cells, the endometriotic cells, produce their own level of estrogen as well. This causes inflammation. So you can get rectal tissue, sometimes known as period poops. You can get bladder pain. You can get pain on having sex as well. So that's either superficial penetration or deep penetration as well. We also know that women also experience painful, heavy periods, and that could be a week to 10 days before their bleed starts and throughout their bleed, and then subsequently once their bleed stops. We also understand that women can experience leg pain because that inflammatory process, if you look at it as all our organs are together, that inflammatory process affects the tissues that are affected in our pelvis. And we think about 1 in 8 women and girls are affected by endometriosis, but also we know that it impacts them beyond just having their menstrual cycle and impacts their life. So inability to work, inability to go to school for education, inability to participate in activities, and also withdrawing themselves from taking up opportunities that might be offered to them because of their endometriosis.